Hi class, welcome to Module 2. As we start examining exactly what sociology of medicine is looking at, we need to understand some key terms like epidemiology, as well as how we define illness and disease in the United States today and how we explore it across globally. So you've begun with a video on exactly what epidemiology means, and we'll move forward from that. So let's pop over to our PowerPoints for the week and look at Chapter 2. As you start to explore, we look at this original first slide in the PowerPoint, the situations of modern illness. No longer are we looking at diseases like the plague that comes through and kills a big amount of the population, or the flu epidemic that happened in the early 1900s. You can tell from this picture that the sources of modern illness are often man-made, and we start exploring what comes into place. And so we look at the differences between disease and illness. Disease are those things that come across that we can clearly define as the sickness that comes into place versus illness, um, which is the experience that goes back and forth. So as we start to explore this and we look at exactly what disease and illness is, then we see the distribution is based on the biological factors and the rate and the population, um, and exploring those particular areas. So incidence and rates, these are what we track. So the World Health Organization, WHO, and the CDC here in the United States really track the incidence rates and the prevalence rates. And that's given out the number of cases that happen in the United States this year versus the whole population, give us the incident rates. Now, the same works globally. So think about the fact as we look at the number of people, and we looked at the Ebola scare that occurred like 2 years ago, and we have to look at it, and the per incident rate across the world population was extremely small. But the incident rate, when we looked at the countries it was coming out of, Sierra Leone, all in those other areas, then we really had to explore it at a very different level. And then prevalence rates. It's the number of living with the disease over the population in this particular year. So what do we think about here? Especially we think about the incidences of AIDS. And so the number of people living with the disease, it continued to increase per the population because we've had such success in making the disease workable for the population, that people can live with HIV positive and even AIDS as we look at it. And then there's the age adjustment rate that comes into place. So some key understanding then comes across is that there's a difference between raw numbers, the incidence rates, and those prevalence rates that we just went over. So a few more epidemiological terms. Morbidity, that's our look at illness and who gets it. The mortality rates are the death rates. And we look at life expectancy. And we talk about life expectancy a great deal, especially when we talk about aging, and we talk about even life expectancy when diagnosed. But we know that the average age in the United States today had been going up. It's been stable and almost going down for the last 2 years. But we look at life expectancy rates of a person with average age is 72 now, as we move forward and we start to explore the difference. Now, why are these important? Because we start comparing these to the social institutions that come into place that greatly affects it. And so we look at social class, especially poverty, and we look at gender and race related to these terms. So it's important to understand exactly what comes into place. So premature deaths. Those are identified the manufacturers of illness, and they focus on upstream. Interesting as we start to examine that and what we're meaning in the process. And so if you look at exactly what we're meaning in that process, we're looking at, we identify the manufacturers of illness. Who are they? Is it age? Is it arthritis? Is it a diagnosis? What comes into place? What creates illness that exists out there? And you're going to see that these social forces really start coming into place. So let me move on to the next slide. And so we see the underlying causes for premature death in the United States. And number one is tobacco, all right? And diet is pretty significantly behind it, isn't it? And so that we see that there's a significant amount that are not biological factors, but sociological factors that come into place. The choice to use alcohol, the choice to use firearms, the use of tobacco are high points of what causes premature death. That we're not dying due to illness, but the use of other things, including toxic agents, which we may or may not have control over, and the use of drugs in our body, and then the catching of disease. So as we explore them, then who are the manufacturers of this that we look at upstream? Now, I was very limited, and when I explained, was back on this slide, identify the manufacturers of illness and the focus on the efforts upstream. So what are we focusing on? And how are we going to change the behaviors? You're going to notice that your discussion question this week brings us, you actually have two separate discussion questions, but one of them brings to how do we change the behavior of humans in the United States? Yeah, how do we change those things? Well, a lot of it is focused on upstream and who is handling the process and where we're going with such items as the society that continues to use alcohol, or in fact, we look at diet and exercise and obesity, and yet obesity is not even as tied to diet and exercise or to exercise as much as it is to the introduction of a poor diet. So we have to maintain how we look at those particular situations, what we're going to do to explore those, and we see the social consequences that come into place and what ties it all together. So as you run through these PowerPoint slides, you're going to see the use of tobacco in the last 30 days among U.S. high school seniors, and this particular data comes from the National Center for Health Statistics 2014, and we can see how it's changed over time, right? And we can see the difference between alcohol, cocaine, binge drinking, and cigarettes, and how that continues. Notice how we're more aware of how those behaviors affect. And so when we look at items such as cocaine, we know that there's been a dropping rate, but we still have a high concern. When we look at cigarettes and we follow those diamonds through, we see the increase in the drop, and yet not near the drop that we would like to see. And then the use of alcohol. And what's gone into place? Here's your social issues. What's the difference? And have we moved for Mothers Against Drunk Drivers and Students Against Drunk Drivers, SAD? Have they made an impact within the process and changed some of the view within it? And yet we still face over issues. And then we have the issue of obesity, and look at the age range here of obesity, and still the largest amount of obesity is after the age of 15, as we see that growing rate of 20-year-olds and higher up in here, and we see that large difference. And perhaps you can start thinking about this issue of obesity that affects our health is definitely tied to our lifestyles, isn't it? And what's available. And then think about the American working population. How much of it is tied to sitting in chairs, such as my job when I'm working with you online, and changes the way we behave. Overall, we have to look at the social condition and social status and see how it works within the healthcare system. This is a big focus of medical sociology. So we really emphasize looking at uh, emphasizes groups, right? We emphasize looking at these group behaviors rather than individual behaviors in the health lifestyle theory. And we look at the living conditions and think about the fact that we rely on cars and we don't walk. We look at demographic situations. We know that people that live in inner cities that are polluted may have more health problems, but they also, if they don't have the access to immediate transportation, may be walking more, may be doing more for their health within the process. And we start to look at living conditions, those demographic circumstances, and that where we belong in the cultural membership. As you start to explore that, you're going to see that the sociological issues really come up. Is it structure over agency? And so what influences our behaviors and how we interact and how we work with the process? So, um, discussions of health projects. It says in a group, define your health projects. Describe someone you know who engages in a healthy project and give examples from your friends and whatever. I want you to think about these individually as you start thinking about this. But what defines that healthy project? What puts us in the place? And we know that as groups, we work differently together, right, as a class, and that's one of the issues that we have online. I can't put you into a group exactly in that way to discuss, but you will be discussing on a discussion board. But think about this. When we start to understand health behaviors, we know that people that are tied to more groups will get fat with friends and they will get thin with friends, that there are significant pulls together, and then you can describe those healthy projects. Stress, a significant part of health, isn't it? Now, this is a big change when we look at what health is today, the versus chronic illness versus acute illness. And stress really comes into some of those acute levels. Now, stress can lead to more acute illness, that you're more likely to catch a cold. You're more likely to be acceptable to something. But stress of illness itself can cause chronic illness to get worse. So that we see that these emotions and it's our response to stress that come into place. Our book does a great job at looking at race, class, and gender, and then those social stresses that really come into place. These are important pieces that you're going to be picking up as you move forward to explore the films of the modules this week. So, your PowerPoints, a quick guide to them, and use those to tie yourself together with the chapter. Now let me pull up the module for the week and see if I can get it back up here. Where did it go? There it is. Okay, it won't pop up. We're getting there. Let me see what I can do to get us to the right place. See if it will go. There, sorry for the delay. Your point in this chapter is, of course, to read the chapter. You're going to be looking at a video on global healthcare challenges, and this is a a series done by PBS that you're going to be picking up pieces of, and this is the first part of it. Previously, I had students in doing this look at some of the changes within AIDS, an absolutely fantastic video, but it's almost 3 hours long. This is going to begin to look at the global healthcare challenges and look at obesity and the general look at what we need to move forward. So this is kind of guiding you into the thought process. The second thing I want you to look at is the new notice posted this last week by the CDC for looking at the virus being transmitted by mosquitoes that is causing a severe concern, especially in Central and South America, Brazil, as well as far as pregnant mothers who contract the uh, Zika virus and the children being born severely um, compromised. These babies are born using the term with severe disabilities here. And so there's a big concern as we start thinking about how viruses spread and how the world becomes a global issue and not always just our own issue. Then complete your discussion board and the assessment for this module, if you choose to do it. Again, remember you only have to complete 10, is a multiple choice quiz available to you by clicking there or going under quizzes. I've also included the chapter summary for you, which goes into some detail but helps you divide out what you're reading as you start looking at these key concepts within what is going on. And again, you can see the tie between poverty and disease, between gender and disease, between all those ethnic issues that come into place as we start to explore those social conditions of medicine at a deeper level. Hope it's given you a good start. Again, make sure you're asking me questions, and as you're doing that, make sure that if it's about the class, you ask under questions about the course, and I will try to respond. And if you have questions, see if anyone else has asked the same question, and we will move forward. Second week of the semester. Have a great day.